Error. Electricity in line. Override accepted. Infusion initiated.
Welcome to the INS Infusion Room, the official podcast of the Infusion Nurses Society. In this podcast, we explore all things infusion therapy through a real-life conversation, covering the latest trends, new research, evolving standards, and key industry insights. Whether you're an experienced infusion nurse or new to the field, we aim to keep you informed and empowered with the knowledge to stay at the forefront of the profession. My name's Derek, and I'm your host. Let's dive in.
Welcome to another episode of the INS Infusion Room. Today we are in the exhibit hall again for the special series coming straight from the annual conference. So as you can see, I have the famous Barb Nickel, chair of the Standards of Practice Committee, and she has a lot to say.
Indeed. You ask the questions and I have the words, indeed.
I'm just going to jump right in.
Okay.
Unless we want to give a little bio for those that maybe don't know you. Maybe give the listeners a little bit about your experience and what led you to INS.
Yeah, that's a great story, actually, because I do this from the podium a great deal. I was a critical care nurse for many, many years, and I started doing policies, procedures, and I stumbled across INS. I'd never heard of it before in the mid-2000s. And found the standards of practice, helped with policies, procedures. And then I thought, I'm just going to go to one of their conferences. I've never been to one. I'm a pretty smart ICU nurse. Maybe I have a few things to learn, though. And I went to a conference in Florida. I'd never been to one, and I was blown away at what I didn't know and what I could bring back to my organization. And so I got more involved. I got my CRNI, crazy. I did it in between semesters of my master's. I graduated as a CNS, clinical nurse specialist. I work in a very, very large system. I started publishing actually in AACN's critical care nurse because I'm a long-term member there. I'm certified in critical care. And I reached out to Lisa because my first article, and I really think it's important for us to bridge our organizations, was application of the INS standards into critical care. And so I reached out to Lisa Gorski and said, would you review this? I've never published before. I want to make sure that I'm accurate. And she did and gave me great intel. And so I was published for the first time in 2019 in CCN, Critical Care Nurse.
And what was Lisa's role at that time?
She was chair of the standards at that time. And I had just come to know her at conferences. I was also on INS's NCOE for 3 years as a member, National Council on Education, and then I was chair of that organization, and that was back when we worked with ANCC, so I was also lead nurse planner for INS at the time, so we did application, we did a lot of work. Anyway, my first publication then, Lisa invited me to be on the standards because of that publication, and so then I was a co-author of the 8th edition of the standards. And I remember walking into the room in Boston the first time we had that standards group and all of the incredible minds around that table. And I thought, I'm just an ICU nurse from Nebraska. I don't even belong here.
Did you have imposter syndrome a little bit?
Oh my goodness, yeah. And I thought, but I'm an ICU nurse. I don't shrink from a challenge, and so I dove in and I learned, and it was incredible. I was mentored by so many people, including Lisa. And she actually then INS invited me to be chair of the 9th edition of the standards. And now I'm chair of the 10th edition. So that's a long story, but I really, and now I've published multiple articles as well as the standards, really trying to bridge gaps. And I've spoken at American Med-Surg Nursing Conference. Again, I think we need to make connections between our various areas of expertise. I think that's critical. But I also want to just say how important volunteerism is to anybody listening. They need to get out to the websites of all of their whatever organizations they belong to, because you will never know what you can do as a volunteer until you tap into it.
So you talked about
the sky is the limit.
Yeah, absolutely. You talk about moving into the new standards. When did the new standards release?
Yeah, they will come out early 2027.
So, we're a couple years out from that.
Indeed.
And some people may think that's a long time.
It is.
But does it feel like a long time when you're on the committee? It probably goes by pretty quickly, right?
There is. The 9th edition has over 2,000 references.
Oh, my goodness.
But that isn't how many that we look at. Obviously, we have to screen them because the standards are representative of the highest quality evidence in all of the areas that are covered. And, of course, it's comprehensive. It's also global. And so, yes, it takes quite a while. We have actually a larger committee than we've ever had before. When we actually also put out a call for committee members for the very first time, which was exciting. And we had 36 applicants from 12 different countries.
Wow.
To be a part of the standards committee. And so Don Barrett, the editor at that time, and I interviewed our top choices. And then we actually decided to increase the number on the committee to share the work a little bit more equitably.
Yeah, absolutely.
But most exciting, again, we've got 4 countries now represented on the standards, nurses from all clinical settings. We have a microbiologist, we have a pharmacist, and then, of course, Dr. Victor Rosenthal was a member, and now he's the chief editor of the standards themselves.
And we just spoke with him earlier,
yes.
So that's exciting to see these changes. I can't wait to see what we come up with.
Yes.
We, as in you, and your team.
Us,
not to take your light. You talked about appraising evidence.
Yes.
And levels of evidence. Can you elaborate a little bit more as to what that entails?
Yes.
And while reading the standards of practice, how can clinicians identify those areas?
Yeah. That's a complex question.
Very complex.
So first of all, I'll talk about it from what the standards are and how they're composed. So actually, INS and parent organization, INCC, does a study of what the infusion nurse or infusion practice, infusion therapy really looks like. And that's really how the 66 standards are really composed to represent all of infusion therapy and the critical pieces of it. But as the committee gets together each time, we review that table of contents. And I can tell the group that there will be changes for the 2027 as there were for 2024, because we've already revised the table of contents. Then we divide up the standards and who's going to be the author or authors of the individual standards based on areas of expertise. Obviously, Dr. Rosenthal and our microbiologist will be really managing the hand hygiene, the precautions, and the infection, VAD-related infection standards. So we'll divide those up, and that's going really well. We have quite a process. We have a health sciences librarian that does our searches for us and pulls references into what we call EndNote, which is basically a repository for references. We scan those, we really review them.
Everything that's out there.
Yes, yeah, that's everything that's possible to find in that search. And we can add references to it, and people can send them to us. We move, once we've decided, okay, what of the new references do we need? What do we need from the 2024 edition? We move those over to another platform, and then we actually appraise the each reference individually. And so, again, it takes quite a while. And we're not looking for it to be a comprehensive. It doesn't include all references. We are really looking for the highest level of evidence. And so INS has a level of evidence table that they developed several iterations ago. We actually, 2 of the members and myself over the summer, reevaluated that against other tools to say, is it still what we want to use? And so it looks at the highest level of evidence being meta-analyses, standard systematic reviews, and then we break it down. A level 2 would be maybe a systematic review of different types of studies, and then randomized control trials, level 3, and then on down. So how the person can use that is to look at a practice recommendation and say, what is the level of evidence here? And our references are listed there, and you can look in the reference list, find the journal articles, and we will give it a level of evidence, say of a 4, meaning it has been studied in a research study, but it's not yet been done in a systematic review. So it's good level of evidence, but not maybe the highest. So again, look at the research behind a practice recommendation to understand it better, because really what the standards is a compendium of all of the current references. We did add a piece this time because we're always evolving and getting better. Johns Hopkins, and we evaluated several different organizations, but Johns Hopkins just went through a review of their appraisal tools, and we got permission actually even early from them to use them, and so we have them loaded, and we look at those specifically as a evaluation of quality. So we're using the INS table to say what is the level of evidence, but then we ask additional questions. Is it a quality? Does it meet the criteria for strong, moderate, or limited quality? And so that's also going to be reflected in our methodology. So again, a very rigorous process. Once we have all of them appraised, then we make the edits to the document.
So how long does the initial process take?
For an individual standard, we really got rolling in January. Once we trained everyone on all of these platforms, they were really kind of let free to start working. And our first standard was due the first part of April.
Okay.
But now they're going to get quicker and quicker and quicker because they understand the process. So we'll be cranking out the new revisions probably every 20 to 30 days.
Wow.
Yeah. So it's very time consuming, but it's a labor of love.
Yeah.
And the networking and the teamwork that's going on with this team is wonderful. Yeah.
What is the most valuable thing that you've obtained by being the chair of the INS standards?
Oh, wow. That's another great question. Well, number one is just meeting people and feeling like you can assist and guide in practice and really improve patient outcomes.
Absolutely.
That's really what this is about, is just what can we do to improve the patient experience. In fact, it's interesting because, again, as a volunteer, I didn't anticipate this, but being the chair of the INS standards has really enhanced my professional role. Yeah. So as a CNS in a very large system,
which you're very active in still.
Indeed. Oh, very active. We are starting now a prospective multi-center study on outcomes in various vascular accesses from vasopressors. That's kind of hard to say. That was a lot of V's.
That's a lot of, yes.
In fact, we're calling the study Viva.
Yeah, it makes sense.
I know. It is very appropriate. But all of that was, and the advocacy that I could do as a professional at the table with providers and pharmacy to say we need to take good care of our patients. We need to optimize outcomes. And there's not enough evidence to say, how can we do this safely, especially in the midline? And so as a large system, we need to enter in and add to the body of knowledge.
Well, thank you for that.
Yeah.
That's amazing.
Also used, because I was also part of the evidence-based list of non-anti-neoplastics list that came out. That was in September, October of the Journal of Infusion Nursing.
Has it been that late? It's been that long already?
Uh-huh.
How?
I know. Well, we worked on it for 2 years before it even came out.
Yeah.
But I used that work to then, again, advocate in my system, and this is part of my talk tomorrow, working with pharmacy to create a common vesicant list across a system that spans 24 states, 150 hospitals.
Wow.
And because we have a common vesicant list across all of them that are plugged into the EHRs, we can now educate in a standardized way.
And that's key right there, plugging
exactly.
it into the EHR.
Yes. And we can report.
That resource is so important.
It is. It is. So, again, all of this volunteer work, you can just feed it right back into your role, and it's incredible. But being a nurse that can be at the table speaking evidence-based practice to providers, to pharmacy, we can really elevate nursing to that level and say, we are an important partner here.
Yeah.
Yeah.
So can I ask you the important question of what's the difference between a guideline and a standard? Can we discuss that?
That's a very good question.
I hear those words interchanged a lot, and I think there's a lot of misconceptions with that.
There are.
And it's not the same word.
Right.
right?
Right. Again, the standards are broken down. The standard of practice are broken down. So in the individual document, it starts with standard statements. And those really are the level of policy.
Yes.
They are so universal, they don't even have references. They're critical. Then underneath, we have practice recommendations that are not as universal, not as accepted, but represented in some level of evidence. So they are more considerations. And so a standard of practice, at least in all of the realms that I am in, but I believe these terms have different definitions depending on where you are, but a standard of practice really does guide practice. The standard statements really are policy. The practice recommendations are more, how do I apply that a little more specifically to a granular level?
Yes.
And that's where you get into guidelines.
Absolutely.
Yeah. So really guiding practice a little more individually. So it's not at the level of policy. It's not a statement that can be applied universally, but a way to really apply it to a clinical situation where there may be more than one answer.
I like the way that you explain that. Very thorough.
Okay.
And I get a lot of questions about the legalities.
Mm-hmm.
Is a guideline going to hold a clinician liable?
Mm-hmm.
Obviously, you're not an attorney and you can't give those advice.
Right.
But Russ is going to be on stage.
He will.
With Lori doing a wonderful presentation.
Right.
Here at INS 25. But that's a question I get a lot. What liability does the clinician hold when we're talking standards versus guidelines?
Right. I think it's important to understand what your facility documents are, because that's really primarily what you're going to be held to. So you need to know your own facility policies, procedures, and if they're not adequate, then you need to step into that space and bring them up to the current level. For me, actually, I'm a part of a collaborative that goes across our system, and we created our national policies.
Great.
And they are in sync with the evidence, obviously in sync with the standards. But our online nursing procedure manual that we use and link everything to is in lockstep with INS.
That's great.
Yeah. And so I know that we're held to the INS standards.
Sure.
Number one, because it is best practice, or at least the highest level that's available. But number two, it's because it's what my organization has chosen in how we create our policies and our procedures. You may vary from that. Yeah, and any surveyor, any lawyer is going to look first, what does your organization say?
Absolutely.
And if it says XXX, then that's what you need to do, especially if it's at a policy level. If your organization, such as like mine, cites INS, and that's really what we're held to, then you're held to our standard. Hopefully that helps.
Yeah, it does. And I think that clears a lot of the confusion around that.
Mm-hmm.
So you are very busy here at INS 25.
Right.
Between the networking, talking, answering questions, you're also going to be on stage.
Indeed.
A few times.
Indeed.
Right?
Well,
So
two at least. Right?
Two, yeah. One with me.
Yes.
Final session, the INS game show, where Barb will be the referee.
I will. In proper attire.
I heard that you had the referee shirt.
I do.
And whistle ready to
I
go.
do. I'm ready.
I got my sparkly tie.
Oh, good.
I'm excited for that.
Yep.
But we will have a grand prize winner for that. But the other session, let's talk about that and what you're doing within that work.
I do quite a bit of speaking across the country, and one of the sessions I did was in upstate New York, and it was on really the standards. And in the audience were two people that I didn't know. It was a couple, actually, that are both pharmacists. And I was able to strike up a conversation after the session with them. One of them, a patient safety medication officer, pharmacy in a large system as well. And as we then continued to talk, we actually started hatching how important nursing and pharmacy collaboration is, and how important it is that we really work together, that we can't operate in silos. And he and I actually did 2 webinars toward the end of last year. And so what we did was consolidate those 2 webinars into one session that really talks about the criticality of working directly with pharmacy, knowing their expertise and workflows are different than nursing, but knowing how we can optimize them to really improve our patient outcomes. And so that's what the talk will be on with Scott Murray. who is, I think, flying right now to Vegas from New York. Yes. Now, interestingly enough, with all the work that Scott and I did together, we needed a pharmacist on the standards.
Yeah.
And he became more and more aware of what that might look like. And I asked him, would he consider being our pharmacist? And he agreed. And so he's stepping into a space that is not as familiar to him, and learning so much about evidence-based review and learning about vascular access, and we're learning from him.
Yeah.
And so again, that's that multidisciplinary flavor of the standards that's incredible.
And I love that you're bridging that.
Yes.
Because there's no conflict between pharmacy and nursing ever.
None. And we don't speak the different language.
And great, and we speak the same language.
Yes.
So thank you for that. Well, Barb, this has been a great conversation. Do you have any final thoughts before we end today's episode?
No, I hope everyone has a wonderful time, are learning a great deal, and we are very available and approachable on the standards. And so if there's anything we can do to help, we really want to.
All right. Well, thank you for being a guest. And
Thank
as
you.
always, thanks for joining the INS Infusion Room.
Infusion complete.